And welcome back. It's 4:30 in the middle of the drive home, and we have a couple of guests here.
All right.
From HSHS, St. Anthony's Memorial Hospital. We have John and Alex.
Hey, guys.
Good afternoon, guys.
Good afternoon. Thanks for having us.
You are quite welcome. Okay, so I asked them as soon as they came in. I go, I know we're talking about dry needling today.
Yes.
You didn't bring any props, did you? And
Please.
I did not, unfortunately, this time. But I said next time I'll bring a couple. So
For the morning show, too.
Yeah, next time. Yeah, okay. Well, I'll see what day that is. I'm going to take a vacation day. I'm kidding. I'm so kidding. I'm so kidding.
No.
We welcome you guys, and I know we've got a lot of stuff to kind of get to because you guys have a lot of stuff you want to talk about.
Yeah.
We cover a lot of different things, and this is just, again, starting, scratching the surface, basically.
Yeah.
Right. So I guess if you guys want to introduce yourselves and basically say who you are and actually what you guys do.
Yeah, sure. So my name's Alex Kastl. I'm a doctor of physical therapy. Been working with HSHS St. Anthony's for about 3 years now. And I do a little bit of everything. My focus is, and kind of what my passion is pediatrics. So I work a lot with kids, but I also, work with adults too. And I have my certification in dry needling and ASTYM as well. And I work 4 10-hour days, so I'm at the clinic, 4 days a week and taking care of patients. So,
yeah, and I am John Lankow, and I'm a physical therapist assistant. So I've been with St. Anthony's now for 6.5, it'll be coming on 7 years, and just I have been doing all different kinds of stuff. So I kind of run the full gamut, and that's the way we are with most things at the clinic is. We're treating birth to end of life, basically. So, and it's just something that I've been passionate about for years and really enjoy.
That's great. So I know we were talking about dry needling a little bit, but what actually is that?
So dry needling is a treatment intervention, and where we take a thin monofilament needle, and we will kind of place that into the skin anywhere we find like a trigger point or a knot in a muscle is what most people will kind of recognize it as, and it's just a real tender spot, and a lot of times taking that needle deep into that tissue there can cause a local twitch response to that muscle and kind of get that knot to release or kind of relax and stretch out so that we can follow that up with proper exercises to promote normal movement patterns with our patients.
Does that hurt?
Yeah, so it's a really good question. A lot of people are nervous about that, and it differs from patient to patient. Some patients, they will feel it, and sometimes it's just a quick kind of sharp pain just when we hit that trigger point, and then that muscle kind of relax, and people really find a lot of relief with it. And then some patients, they don't feel the needle go in at all. So it just kind of differs patient to patient.
Well, you mentioned, like a muscle or a knot or something. I mean, for this, that's the treatment, but what do people come to you saying? Like, hey, I've got this pain in my shoulder or my abdomen, or I don't know where this stuff is at.
Your back.
All over.
Yeah, so a lot of times, we can treat a lot of different areas with this dry needling. Some of the most common things are hip pain, back pain. We treat people that have headaches with these.
Really?
Yeah, so and a lot of neck pain and shoulder pain are most of the common ones we use. I actually had a lady called me the other day and was like, well, could you treat golfer's elbow with this? And I said, absolutely, we could treat that. So there's a lot of different things we can treat
now,
with
is
this.
Golfer's elbow like tennis elbow?
I've never heard
I've
of that
never heard
either.
of golfer's elbow.
It is. It's just on the inside instead of the outside of the arm.
Exactly.
That's the difference.
Okay, I'm learning something new.
See, there you go.
Interesting.
Yeah.
And I got to ask back on your headache question.
Yes.
If someone comes to you and someone tells you something about, I have headaches and wherever it's at, it's still in your head. Where would you do the dry needling
Yeah, so
procedure?
it's in the back. It's in a group of muscles called your suboccipitals, which just sit kind of right in the back side of the base of your skull.
Okay.
And a lot of times people will develop just these tension headaches from stress or, whatever sitting posture. If you sit at a desk all day, you're looking at a screen all day, you can get some tightness built up in those muscles and it causes headaches. So we can needle those muscles and people tend to find a lot of good relief with their headaches from that.
Is there an age group? I mean, how young do you go for this? Or
Yeah,
is it mainly adults?
I typically do mainly adults.
Okay.
You know, I've not really done any kids at all with this,
Right.
just because they're still developing, their nervous system's still developing, stuff like that. So I tend to stick to adults with using this treatment.
Okay. Now, I think I asked this, before we went on, but and I know you already answered it for me, but the listeners didn't hear me ask you this. Is it like acupuncture?
Yeah, that's a very common question I get all the time, and this is what I tell all my patients. I'm like, it is the only similarity they have is the type of needle that we use. Acupuncture focuses mostly on just going into the first layer of that skin, where we're actually taking these needles for dry needling deep into the muscle tissue. So there's a lot of different philosophies between the two, but it's the only thing's the same as the needle.
Wow.
Yeah.
Okay. Well, and you mentioned, a little bit of how you proceed with that. Do patients like sit in some kind of a chair or lay down on a bed, or how does the actual physical process work?
Yeah. So I'll bring a patient usually into a room, unless we're treating an area that's easily, we can get to, that we wouldn't need a private room or anything, but and then I'll just position them however they're comfortable most of the time. I can usually dry needle, certain muscle groups in a couple different positions. So I just kind of position them in whatever they feel comfortable with. A lot of times it's either laying down on their belly, if I'm doing, on the back side of the head, or up on the neck, or sometimes I'll do it in sitting. So.
What kind of a time frame would that take?
That's what I was going to ask
I
him.
have no idea.
Can I take a nap?
Yeah.
So it's actually really quick and short. I probably spend more time explaining the procedure than actually doing it.
Really?
Yeah, just so they feel comfortable. But I mean, usually what we do is, sometimes we'll put the needle in, and we'll just piston it up and down a couple times, or sometimes we'll kind of float the needle into that tissue, and we'll hook them up to electric stim so we can stim the muscle and get the contractions out of the muscle.
Okay.
And so I'll leave them on that stim for, that electrical stim for a couple, like a minute or two, and then I take it out. So it's really short.
Okay. Well, I guess that leads us into the other. What is
another stim?
Yeah.
Yeah.
What's
ASTYM.
ASTYM?
So we'll jump and make sure. So a lot of people confuse that with eSTIM or electrical stim. It is not that. It's an instrument-based process to work on muscles and tendons in very specific patterns in order to be able to get the body to recognize tissue that basically doesn't belong. If you think about how, if you talk about neck pain or you talk about back pain and you have that for long periods of time, you have that chronic kind of pain that just hangs around, your body just gets upset and it doesn't really want to ever think about kind of healing. It just kind of says, hey, I'm done. You keep beating me up doing the same thing over and over. I'm not going to fix you anymore. And so you stay with this chronic pain. And obviously that's not where you want to live on a constant basis. So with the ASTYM, by passing over the muscles, we get the body to recognize that tissue, and then through stretching and exercise, then we're able to help the body where to lay new tissue down at that point and start the process over. So it really, a lot of people feel like it's almost like a deep massage.
Okay.
And it gives you some of those same sensations. And of course, you want to drink plenty of water and, do those same type of things, but it's affecting the muscles differently. So it won't quite go in. But a lot of people like it, again, the same kind of areas we're talking about with the dry needling, the neck, the back. We work on the legs a lot. So a lot of different people that we treat with this, again, all age groups. We do go into the younger children. I actually just had a 12-year-old that I was just treating before I came on air. And so we can treat a broader range with this. And the great thing is we can affect change. Again, this isn't a long treatment. 10, maybe 15 minutes tops, depending on what all we're treating. And you can really get a good effect. And then we go into stretches, and a lot of times those stretches happen so much easier than what they would normally. So.
Oh, okay.
You mean like specialized stretches of some sort?
Well, even just your normal stuff. So if you're talking about a simple, just stretching your calf, up against the wall, when you look at that, if we actually ASTYM through that muscle beforehand, that muscle will actually loosen up and allow for much more lengthening of that muscle than beforehand. So you can get a much more deeper stretch at that point than what you could ever get just by going in and just doing a normal stretch.
What would like an ASTYM instrument look like?
Yeah, they're kind
I
of
have
hard
no
to
idea.
describe. I mean, when you look at it, they are very specialized tools. They're designed for us ergonomically, but also so that it's kind of a hard plastic, if you can imagine that. And there's different ones that have different edges. And the idea is that it will actually give me feedback as well. So not only are you getting the sensation of it, but I'm also getting feedback from what that muscle is telling me, and I know what areas specifically to focus on.
All right. Now, do patients need a doctor? I mean, like a doctor order
So
for these services?
Yeah, for either the dry needling or the ASTYM, either one, your doctor's just going to send you for your standard stuff, and they're going to basically say, physical therapy, eval, and treat. And we're going to decide to use these particular modalities within the scope of what we're already working on. So if it's something that Alex sees a patient for, and he says, you know what, I think this patient would benefit from the dry needling or from the ASTYM, we're just automatically going to jump to it.
Yeah,
Okay.
it sounds like, I think you're hinting at that. If you're getting treatment for different other things, maybe related to what you're in there being evaluated for or not, this can be used at the same time concurrently.
Yes,
exactly. It's kind of an extra tool in our toolbox, and as a therapist, we can evaluate and make that assessment and put it in our plan of care, and then we send that to the doctor, and they sign off on it, and we go ahead and just move forward with the treatment. So.
And you have something here about athletes.
Yeah, so we treat a broad range, but also we definitely focus on athletes, a lot of runners. I mean, you can, you guys see it all the time around in just our community. A lot of walkers, a lot of runners, but also cyclists, swimming, for any type of injury. So especially in those particular cases where they don't normally necessarily get to it with normal stretching or normal, we can bring them in, and the dry needling or the ASTYM, either one, can really affect a broader change than just what you can do with your hands alone.
Okay. Now, if someone is needing to get a hold of you, how can they do that?
They can call our clinic at 217-347-1243. That's our main office phone number, or they could email. If they have questions just for me specifically, they can email me at alex.kastl. That's Kastl at hshs.org.
Now, you guys are located in the Richard E. Morgan Sports and Wellness Complex.
That is
okay.
correct. Yeah. So all our outpatient services, whether it be physical, occupational, or speech therapy, are all located in that area.
Very good.
And we definitely are looking forward to some of the other stuff that we've got coming up. I mean, we want to talk about like an AlterG treadmill. We want to talk about blood flow restrictions. So we know we've got some things going forward with you guys that we're looking forward to bringing in as well.
Oh, yeah. We're going to have plenty of more time
yeah.
for conversations with you guys.
Yeah.
So,
Lots of options, but there's a lot of issues out there.
Yes,
Oh, yeah.
definitely.
and so far, for the month of January when Tammy scheduled all of these, I had no idea you guys offered any of these
No kidding.
services
Yeah.
inside the complex, the
Yes.
sports complex.
Yeah.
Yeah.
Had no idea.
I didn't know it was offered anywhere around here.
No.
Most of the stuff I haven't
No.
heard of. So
Right.
it's good options.
So
Yeah.
I'm learning. Just
A lot of the stuff that we're talking about, even it's not even certain things. You'll find certain techniques that are obviously offered in the area, but some things that we talk about and we do aren't even necessarily close to this area. So Effingham's got a broad base of using our services to be able to get a lot of things done.
okay.
Very
well,
cool.
thank you guys for coming in. Thank
Yeah.
you, John.
Thank you.
Thank
Alex.
you so much for the time.
Yes, we
And,
appreciate it so much.
We look forward to you guys coming back again sometime in February. I think we've got you scheduled.
Yes. Absolutely.
Definitely.
So, and
Keep up the
learn
good
more.
work.
And, don't get all excited, Brian, because I don't know if they're bringing needles or not.
I will
so.
bring needles. I promise.
Bring the long ones.
Okay.
Oh,
well,
okay.
yeah, I was going to say, if we do, then at least Wayne will be here so he can, man
yeah.
the board.
There
Yeah.
you go. That
Oh,
sounds
he's
good.
good. He could go for a
Absolutely.
treatment, I think.
Yeah.
All right. All
So,
right.
thank you guys from
Thank you.
HSHS,
Thank you.
St. Anthony's Memorial
Yeah.
Hospital. Anthony's Memorial
Yeah.
Hospital. Anthony's